Welcome to a Perspective Roundtable of the New England Journal of Medicine. I'm Meredith Rosenthal, Professor of Health Economics and Policy at the Harvard School of Public Health. Some of today's major public health problems, including obesity-related and tobacco-related diseases, are caused or exacerbated in part by individual behavior and lifestyle choices. U.S. policymakers at all levels of government are struggling to find ways to intervene and promote wellness and prevent these health problems without overstepping the bounds of government intervention or infringing on personal liberties. What can and should government do to prevent obesity and tobacco use? With me here to discuss these issues are Tom Farley, Health Commissioner of New York City, Steve Gortmaker, Professor of the Practice of Health Sociology at the Harvard School of Public Health, and Cass Sunstein, University Professor at Harvard. Tom, my first question is for you. New York City has been out in front in regulating sugar-sweetened beverages, in particular the portion cap. Recently, a state Supreme Court struck down that rule. What do you think the next step is on sugary beverages? What should government do now?
Well, first of all, sugary drinks are a major contributor to our obesity epidemic. And there are a number of things that we've done in New York City, including the portion cap, to try to reduce their consumption, and other things that we proposed that haven't gone through that we still support. One, we proposed a tax on sugary drinks. We've also proposed restriction on the use of food stamps for sugary drinks, while food stamp recipients would still get the same dollar amount that they currently get. We've also proposed the portion cap. And we've also done a lot to try to educate people about the risks of sugary drinks and do things like get them out of schools. So it's all part of a general strategy, and it's working. We're seeing declines in consumption of sugar drinks in New York City and declines in childhood obesity.
Is there a role for public health professionals, clinicians, and other private actors to complement those government efforts?
Well, certainly, we consider ourselves public health professionals, and that's something that we're working in the health department. But we think that getting out messages about the risks of those food items that are the biggest contributors to the obesity epidemic is something that everybody needs to do. Clinicians are out there educating patients. Educators are in contact with children. The more that we can reinforce those messages, the more we can get people to adopt a healthier diet to reduce the epidemic.
Steve, in your community-based interventions, what have you learned that might help us understand the extent to which regulations such as the portion control regulations, how effective those might be? What have you seen in your work?
Well, we know, for example, that if you ban sugar-sweetened beverages in schools, like they did in Boston here, that you reduce consumption of sugary beverages among children. That was highly effective. It's a pretty inexpensive intervention. And we've also been seeing, I think, that you can also restrict sales on city property and stop advertising on city property, as a lot of places do, like in fire stations, police stations, and city halls. I mean, all those are pretty effective strategies. They don't have large effects on consumption. I think the evidence is that of all the sugary beverages that children consume, only about 12% is consumed on school property, but that can still make a difference. And you start adding up restrictions in a number of public settings like that, and you help make it easier for children to make healthier choices.
As obesity has so many causes, both the built environment as well as food sources, in your work thinking about how to prevent childhood obesity in particular, what do you think the best targets are for government intervention?
Well, some of the best targets have to be on the nutritional intake side, simply because you can make much larger changes there. And there are just a range of things that you can do. Another issue that probably people haven't thought much about is just access to something as simple as water that we have in front of us here. A lot of children don't have much access to water in public schools. There may be one drinking fountain in a cafeteria and 200 children. And so there's not much access. We really think it should be something that schools can promote, and parents can even promote, is make water a primary beverage in a lot of settings for children to be able to hydrate themselves. Seems simple, but it's a non-caloric beverage that's pretty inexpensive and good for you.
So Cass, from a behavioral economics perspective, where do you see the greatest opportunity for these kinds of government interventions? Where are these decision-making failures really most critical for preventing obesity, preventing tobacco use?
Well, I think I'd have a broad view screen and think not just of government, but of the private sector too. And the basic idea is that behind our choices is an architecture. So just as buildings have architecture, so do decisions. So if you go to a cafeteria or a grocery store or a city square, there will be some foods that are accessible and easy, and there will be some that are inaccessible and harder to get. And I think the basic behavioral insight is that what's easy and simple and salient tends to be what people go for, and what's difficult and not salient and complicated, people won't go for. So I think the challenge for all decision makers is to maintain freedom of choice, but also to give healthy choices a simpler path.
And in these policies, developing a better architecture for healthy choices, where is the right level of intervention? Should we largely be thinking about individual consumer decisions? Should we be focusing on vendors, on producers?
All of these deserve attention. So one thing we did in the Obama administration, where I was privileged to serve, was to replace something called the food pyramid, which was a barely comprehensible guide to nutritious choices, with something simpler called the food plate. And that food plate is affecting consumer decisions, which also affect, in turn, producer decisions. Calorie labeling is on the way. That will be directed at providers, but it will inform consumers. So I think for every actor who's involved in promoting health or promoting something that falls short of health, there's a role to play in moving toward a better architecture.
So turning our attention now to tobacco use. Tom, I know in New York, Mayor Bloomberg has proposed both requiring stores to keep cigarettes out of sight and raising the minimum age for purchasing cigarettes. What kind of reaction have you seen so far to these proposals?
Been very positive. But first, just to back up a bit, we've been able to reduce smoking rates in New York City substantially. Teen smoking rates are down by more than half, and adult smoking rates by more than a third over the last 12 years. That means 450,000 fewer smokers in New York City, and I think it's contributed to our increases in life expectancy. But our teen smoking rate has been level, about 8.5% for about the last 3 or 4 years. And we think teens are encouraged to smoke by positive images in the movies and by the promotion at the point of purchase. When kids come in and they see all those packs of cigarettes behind the counter, what's referred to as the power wall, and they see the advertising that goes with it, they see the price discounting, they are tempted to try it out, and smoking seems normal and acceptable. So we propose to do what they've done in other countries, which is to simply say that the packs of cigarettes have to be under the counter or in a cabinet, out of sight, to sort of send a message in society that this is something that we allow but we don't condone. And it's been successful, or at least it's been followed by reductions in teen smoking in Canada. So we proposed that, and we've also proposed raising the sales age to 21. And there's good reason to think that that'll reduce the number of 18 to 21-year-olds who will smoke, as well as even the ones under age 18, because they often get it from their older friends.
And you've not heard much pushback from the retailers in this case?
Well, the small store owners don't like it, the ones that sell cigarettes. But the city council has been very supportive, and the general public has been very supportive. Nobody wants their children to smoke. Even smokers don't want their children to smoke. So this is a really very popular issue.
Cass, coming back to you, another area for preventing tobacco use that has gotten a lot of play over the last several years is with regard to employers' activities around tobacco use. And in fact, some employers have endeavored to not hire smokers. Those rules have come into some conflict with the law in individual states. How should we think about the ethical and legal issues around hiring and offering different benefits to smokers?
Well, there are a couple different ideas. One is that generally in a free society, employers can hire people as they like, subject to prohibitions on discrimination of various sorts. So in a free market, employers get a lot of discretion about who to hire. Second, there are some restrictions in some states against certain barriers to hiring, and there may be a collision there, and of course you have to follow the law. Third, some employers are thinking that the best thing we can do is to help people quit, or to help people make healthy choices and not to stop people from being employed in the first instance. So I would think the first obligation is to make sure the law is followed, and then there's an additional thought, which is what are the most helpful tools for ensuring that public health is promoted. And we need some more empirical evidence on that.
Steve, there have been many successful public health interventions around tobacco use over the last several decades, some of which involve the kinds of strategies that we've discussed. In your community-based work, can you say what you think has been most effective in reducing smoking over the last decade?
Over the last decade, the big picture, over the last few decades, clearly we can't forget the importance of getting marketing off of television. That was huge. And then, of course, the increases in tobacco taxes, the increase in price, and finally, workplace smoking restrictions. I think those three, by far, have had the biggest impact, just driven rates down. And beyond that, it's nice to have a lot of the educational material, but I think most of the other interventions have been much smaller in terms of their effectiveness.
So, Cass, there were some efforts to use graphic images on tobacco packaging that have been used in other countries successfully. And I wonder if you could tell me a little bit about how to think about the limits on regulating commercial speech here in this country and the extent to which that will be a binding constraint as public health efforts of this type move forward.
Yes, so there's a collision between a law enacted by Congress which explicitly required graphic health warnings and a still evolving set of constitutional principles that involve protection of commercial advertising. So it's just true that the protection of commercial advertising under the First Amendment is quite recent. It started in the 1970s. For many, many decades, it was not thought that commercial advertising was safeguarded by the First Amendment. The court's gone the other way. Nonetheless, the government does have room to regulate speech that is, certainly if it's deceptive or misleading, it can regulate it. The graphic health warnings ran into trouble in a divided court, actually, because the judges who struck them down thought there wasn't an adequate evidentiary basis to believe that they would actually do much good. Those of us who worked on the rule in the Obama administration believed we did have an adequate evidentiary basis. The Supreme Court hasn't spoken to it. The Food and Drug Administration is going back to the drawing board and is considering exactly how to comply both with the First Amendment and the congressional direction, which is to have graphic warnings. I do think that the court is reasonably protecting against government overreach because commercial speech is, after all, speech. But we're not speaking here of the center of what the First Amendment is about, which is about political debate and political discussion. So surely there is a route to be found which complies with the court's requirement of an evidentiary foundation, while also responding to the fact that people are often taking a risk that is a risk to their health without having an adequate sense of what the personal consequences to them are of that risk.
So, Tom, we've been talking about what the federal government is doing in this area. Of course, state governments have a strong role to play in taxation, and New York City has really led the way in terms of municipal government activity. Do you see a logic to certain kinds of involvement at different levels of government? How much of this work in preventing obesity and tobacco needs to be local and community-based?
If you look at the history of tobacco control, the innovation really happened locally. And I think that's probably what we're going to see in obesity as well. And from my perspective, the reason is because the industries are more powerful in lobbying at the federal level than they're at the state level, and more powerful at the state level than at the local level. In New York City, we're fortunate that we have a mayor who is not so much subject to the pressures of being an elected official. He doesn't have to raise campaign funds. And we also have a Board of Health, which is a group of scientific experts that can pass rules within a limited health domain, and they can rule simply on their health benefits. They're not subject to the political pressures of elected bodies like city councils or legislatures. And so we've been able to do things that haven't been so much possible in other jurisdictions. In small towns, often the people who are voting on something are people who know each other, and so again, they're less likely to be blocked by commercial interests. So I do think you're going to continue to see innovation first happen at the local level, and then it may later spread to the state and federal level. I think for solutions to these big problems like obesity, ultimately we will need action at all levels.
That was a very compelling political logic for how this might work. Steve, I'm wondering from your sociological perspective, is there a need for tailored community-based interventions around obesity and tobacco, or is that a laboratory of convenience, or do we really need to think about the sociology of behavior?
Well, I think we can always do lots of interesting work at the community level, but it's worthwhile in the world of obesity to step back and to say what's driving the excess energy intake. And what's driving the excess energy intake, a big driver is marketing. It's worthwhile to step back and think about marketing to children, which is always going to be inherently deceptive because children cannot understand the marketing. And right now, at the federal level, we have more restrictions on marketing to adults than we have on marketing to children, which is a bizarre situation because it doesn't meet the science or the reality. So I think there are going to be lots of innovations at the local level, but given the unbridled kind of marketing to children in this country, which is really amazing from a worldwide perspective, and the inherently deceptive nature of that marketing to children. Just watch children's television and you'll see what is advertised, which is just a bunch of junk. I mean, it's not healthful foods or beverages. If you can't do anything about that, you're going to have a very difficult time to do things locally. I mean, you can restrict children's access to advertising on television. I mean, we use electronic devices that help you set timers on the amount of television time that kids get, or restrict their internet time. You know, you can do that, but you're really fighting against a very large number of powerful forces with lots more money than most communities have to defend themselves.
I wonder how we can, through policy, more effectively engage with the private sector on these issues. There's often skepticism when industry, particularly the food industry, comes forward with initiatives around obesity, for example. Is there a way, through different incentives to industry, different policies, that we could get private innovation working on these problems?
We're actually seeing it. The First Lady Michelle Obama's signature initiative has involved childhood obesity, and that has not involved principally regulatory requirements. It's involved careful work with the private sector. And you can see activity on the part of a number of companies, including Walmart and others, which are making significant progress in moving this food supply in a direction that is better for kids. So I think there's no question that in public health areas, a lot of the most important initiatives, if you think about seatbelt buckling or distracted driving or cigarette smoking to date, a lot of the best initiatives have involved interaction with the private sector, which involves appealing often to conscience, which triggering ingenuity. And my hope is in the next few years, especially with the First Lady emphasizing this as her top issue, really, we'll see much more.
Tom, in your work in New York City, how has it worked to engage, for example, restaurant owners and the retailers we talked about before? Are there trade-offs in working with the private sector to accomplish these public health goals?
We've had areas where we regulate the private sector. We've had conflict or we've been sued, but other areas where we're working collaboratively with them. So, for example, we have the thing called the National Salt Reduction Initiative, which is a national initiative that's directed by the New York City Health Department to work collaboratively across the entire food industry to lower the sodium levels in food in a coordinated way, so no one company has a competitive disadvantage over any other companies. And we're making real progress on that. Haven't changed the entire food system, but we've really made some big changes. With restaurants, though, we've had conflicts. We required calorie labeling on chain restaurants. We were the first to do it before it went national. We got a lot of complaints about it. We were sued twice. We won in court, but then at the end, when the calorie counts went up, the restaurants realized that they were not going to lose money, and they came back to us and they said, yeah, actually you guys are right, and some restaurants on their own went national with their calorie counts. So I think that as we progress in addressing obesity and other diet-related diseases, you're always going to see a combination of cooperation and government regulation and some conflict as we go forward.
In thinking about preventing obesity and tobacco use, how far should the government go to regulation that ultimately is designed to change individual choices, perhaps rational choices, but unhealthy ones? How far is too far?
Well, there are two sets of constraints, I think. One is that you want to generally respect freedom of choice. So if people want to eat chocolate candy or if they want to smoke a cigarette, they're allowed to do that. That's part of freedom. But we want to make sure that those choices are informed rather than a product of misinformation or an inadequate appreciation of what people are getting into, especially when there are cumulative costs over time. So freedom of choice is a constraint, but subject to a requirement that people know what they're doing. The second constraint involves a careful analysis of costs and benefits, actual effects. So if you have something that is maybe beyond informing people, a greater restriction, we want to make sure that the benefits justify the costs. And in these areas where the costs tend to be so high, both for individuals and societies, we might be able to have benefits that justify some measures, so long as in the end people do have freedom of choice.
I think first we're going to have to think about different standards or different norms in different communities and probably states. And I think that there will be a good deal of variety there. I also think it's really important to distinguish children from adults. Children don't have the capacity to make the same kind of rational decisions that adults do, and I think to lump kids together with adults is a big mistake that too often gets made. Beyond that, I really agree with thinking about both the effects and the cost of different kind of interventions, and I do think we want to make important choices, best value for money in terms of where we're placing our emphasis. And there are certain things that we can do that will make a huge difference at very low cost, and I do think we want to look for those.
I agree that government shouldn't be telling people what they must eat or what they cannot eat. I'll have to say, though, that people have often misunderstood our portion cap in particular and our approach to sugary drinks even more generally. And that these are not restrictions on choices. What these are is restrictions on marketing. People make their choices within a context that is very much established by the companies that are marketing products. And those companies have one interest, and that is to sell more. In the case of soda, that's something that is contributing to a major epidemic of our time. And so under the portion cap, people can drink as much as they want, they can buy as much as they want, but it's just that the restaurants can't sell something in a container of larger than 16 ounces, which enables people to have the choice, but also because of the way that we know that people tend to make choices, they'll probably more likely take the healthier choice. And so I think we can make tremendous progress by recognizing we're really focusing on regulation or otherwise addressing company marketing, and we're not in any way really interfering with people's choices. It's a nudge.
On behalf of the New England Journal of Medicine, I want to thank you for your participation in this perspective roundtable on government efforts to reduce obesity and tobacco use.